going to use the following couple of videos. We do want to go over the primary care selection process for Medicare patients and why this is important. So we are going to share this with our patients and we'll make this publicly available. So this is time again for Medicare patients to pick their primary care. So this is not traditionally it was happening. It's new. It's a new concept. Started, I believe, 2 years ago. Many of our patients are not actually going through this process. It is a very simple, very straightforward process, and if we can, like we are asking our patients, but we are also asking our providers if they can actually help the patients, basically going to the MyMedicare.gov, and each patient has their own, of course, access. And in some cases with the provider offices, we can actually help those patients while they are maybe having those visits, even either telemedicine or in person. So this is going to affect so many different things with our patients. Being able to keep our patients in the same primary care do have quality outcome. The quality impacts inconsistent data when it's not done correctly. Patients are being reassigned to someone else if they have seen a specialist with the wrong diagnosis, rather like PCP related diagnosis. So we do want to emphasize this as much as possible. So your primary care is who you are seeing for your family and internal medicine related reasons. And we are asking all of our patients to go through this process as it's just started or it's about to start.
It started already.
It started. Now, we also want to be accountable to our patients as the data is public. So we don't want someone else to see our patients and us being graded for those outcome. United Medical ACO has one of the greatest quality outcome in the nation, and we have the least expensive cost management for our patients while we are keeping the quality up there. This is one part where actually our patients can help us by selecting us as their primary care physician. Now, there's also live chat available from that website. That also is, is very useful. And please, if you're a patient of United Medical ACO, and if you're a provider of United Medical ACO, patients do go to these sites and log in and select us. And the provider offices, please help our patients to get these completed so that we can have a good, accurate data. Anthony, I know there's also another one with if the patient has dual plan, I guess, right? If they have dual coverage.
Yeah.
Did you want to explain that?
This impacts our Medicare Advantage contracts in that sense. But just to reinforce the point you were making earlier, the special value of this is it helps us maintain a stable panel, so that we don't have situation where patients are going in and out, and therefore more difficult to control, to estimate what our true costs are, And when a patient selects a primary care physician, that patient is not going to go out of our panel unless the patient now essentially unselects our provider and then goes to a different primary care provider. But as long as a patient is selected PCP, it really won't matter how many visits such a Medicare patient will have with a specialist, for instance. So that factor trumps everything else.
So just so that we kind of have a conclusion on this, again, from the United Medical ACO side for our patients, Medicare patients, we are urging them to complete the form and then make the selection of their primary care, as we are their primary care, update the information so that increases our accountability. And also, since our data is public, we also want to be treated fairly, and we want to do the right thing for our patients. So if you can please update your PCP profile, that would be much appreciated. And for our practices, for you guys to, again, help with this process, it's going to be very important.